City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
Good morning everybody and welcome to the Sunday morning meeting at the Holiday Inn in different surroundings but still the same Holiday Inn. We're all about expats helping expats. So when someone wants a hand, get your wallet out because it might be me who wants a handout. Just joking. Please turn off your phones or turn them to vibrate, as we do every week, so we don't disturb our speaker. And I'm going to have a little wager here. Is there anybody here for the first time who would like to introduce themselves? Say hello, raise your hand, and we'll send the microphone round. No? Okay, I'll keep my $5. If you need to have a conversation, please take it outside so we don't disturb our speaker. And if you need more information on the website, on our club, you can visit our website, PCEC.club. And I know a couple of you might have missed the newsletter and went to the other hotel building and found out we weren't there because we're here. So if you are subscribing to the newsletter, please open, open the newsletter and you'll find the latest information there which would have told you that we're in this part of the hotel. Anyway, there's also, is there a suggestion box or a back table, or is that still in the other room? Anyway, if you want to leave a suggestion, there's a box on the back table. You can put your suggestions in there. And if you want to reply, please put an email address, not a phone number. And if you're not a member, or you wish to renew your membership because it's up, and therefore you can't get any of the discounts afforded the club, please see Judith after the meeting. She's waving her hands, all two of them. She's ambidextrous as well. See Judith and she will happily take your money. Not all of it, but some of it. And there is a bin there with books and DVDs, so if you wish to take any home, please do, they're free. And like I say, if the DVD doesn't work, don't bring it back, throw it away. All right. That's it. I don't have to read that because it's on the screen. Thank you. This Sunday's meeting. Well, we're very happy to welcome back in a timely fashion because of what's happening around Asia. Professor Andy Barraclough will speak on another health issue of interest. His topic will be a vaccination against misleading vaccine misinformation. Sounds complicated, but I'm sure that Andy will explain it all in his usual fashion. Andy is an Emeritus Professor of Public Health and Director of Training at the Empower School of Health. One of his previous topics about dengue fever, and in light of the recent staggering increase in the number of dengue fever cases in Thailand, and also I saw on Asia News this morning in Singapore, they're warning about dengue fever. He will also answer questions the audience may have about dengue fever after, or if he wishes to during his presentation, but Andy will let us know. So keep those questions for Andy, and I'd like to invite him up on stage now. Professor Andy Barraclough.
Okay, greetings today I propose to give you all a vaccination, albeit an audio-visual one. No blood products are involved. Vaccinations are quite a controversial topic these days. That way. Okay, all right. Okay. So I propose we don't take questions during the talk. I have quite a lot of information to present and I'll go quite fast. So I ask you please to keep questions until the end of the talk, and then I'll try and answer all the questions as we go through. Okay. Okay. No, the technology is not there.
You might too far away.
Maybe it's not switched on. So just while we're waiting, the World Health Organization has acknowledged that vaccination misinformation is now a major public health threat. Okay, we're in business. Okay. I regret I am required to read all of this before I continue. The views and opinions expressed in this presentation are those of the presenter, that's me, Andy Barraclough, and do not necessarily represent official policy or position of any of the organisations and bodies to which he is or has been associated. I am not and do not purport to be a vaccination expert. I am a vaccination advocate. The material in this presentation is general background information about vaccination misinformation. This is given in outline and summary form and does not purport to be complete. This presentation was created for informational purposes only. It must not be considered or be used as medical clinical advice or as a recommendation for medical clinical advice. The content of this presentation is not intended to be a substitute for professional medical advice, diagnosis or treatment. Always seek the advice of your physician or other qualified health provider with any questions you have regarding vaccinations. Never disregard professional medical advice or delay in seeking it because of something you have read in this presentation. Okay, I declare my interest. I took money from anyone who couldn't run away fast enough, as I scrounge money to run vaccination campaigns pretty much around the world. I am not connected with any vaccination manufacturers or any other pharmaceutical manufacturers of any kinds. I have no vested interest in vaccines. Nearly all the information I present is published information. It is not my own work. I don't purport it to be my work. It is largely from published peer-reviewed articles readily available on the internet. However, I also have personal experience. I had measles as a child, like many of our age group did. I am an ardent vaccinator. I have vaccinated people on base camp at Everest down to the deepest mines in Botswana. So I believe in vaccinations very strongly. And I have also witnessed the devastating effect of not vaccinating. I have buried too many children in Africa not to believe in vaccinations exceedingly strongly. Since I propose to administer a vaccination to you, I have to have your informed consent and permission, albeit an audio-visual vaccination. Okay? And that means that I explain a little bit about the potential risks and benefits that you may obtain from this presentation. I am not allowed to assume that your silence is consent. So I'm going to explain the risks. Okay? And like most medical charts, you can see the risks are very easy to explain. Okay? And that's part of the problem. Medics have not been very good at explaining things around vaccination, and it confuses people. So the main risk is listening to an old white-haired professor you're bored to sleep. Otherwise you become over-radicalized and then become violently opposed to anti-vaccination campaigns. I hope the benefits are that you're better informed and you feel better empowered to make decisions around vaccinations. The side effect may be that you spend all night searching the internet for vaccination information. Now the good news about this vaccination is you don't have to refrain from alcohol afterwards. Okay? Most vaccinations will be available for beer for anyone that's afterwards. Most vaccinations, you don't have to refrain from alcohol anyway. The advice is more than usual. You should not take more than usual alcohol after a vaccination. However, if your usual intake is 7 large Leo a night, I might suggest a little bit less could be beneficial. It's not that alcohol actually causes side effects of vaccines, but if you do develop side effects, the alcohol makes them worse. That doesn't apply in our case. Okay? So I now need your consent. If you will give me a show of hands that you're willing to sit through the next 45 minutes or hour or so, yes? Anybody opposed? A few there. Sorry?
I oppose if it's an hour.
They say, yeah, it's too long, an hour, okay, right. You want a shorter vaccination time, okay. Okay, now let's just check your experience of vaccination. How many people have had more than 5 vaccinations? Okay, around about 40%, okay. How many of you have never been vaccinated? Nobody, okay, good. How many of you have more than 3 dental fillings? Okay, about 60%. How many of you eat tinned tuna fish? Nearly everybody. Okay. How many of you eat pears if they're available? About half. Okay. Okay, now we do a risk question. How many of you have been to a rural area in Thailand for more than 3 days, visiting the sick buffalo, and have not been vaccinated against Japanese encephalitis? Oh, high risk group here. Nearly half, huh? Nearly half. Okay? So it appears that you're not getting vaccination information. If you were, you would have taken Japanese encephalitis before you went to rural areas in Thailand. We're not getting the information through to you. Okay, so is there a debate about vaccines? Unfortunately, in addition to the anti-vaccination lobby, there is also an anti-debate lobby. There's a whole group of people who say there is no debate, there's nothing to discuss. That's it, end of story. I don't subscribe to that, but that is quite strong. There's always been opposition to vaccines since the very first vaccine were invented. What's changed now is with the advent of social media, it's far easier to reach groups. And unfortunately, social media gives the anti-vaccination groups a credence which they wouldn't normally have in other media. They can reach large groups, okay, and they can get a message to large groups. Most medical professions refuse to enter a vaccination debate. Ask most doctors and they will say, no, I will not enter into a debate with the anti-vaccination groups. Outright, complete refusal. Because it gives them a credence. By hosting a debate, it means they've got something to contribute. And most medical professions say there is nothing, there is no evidence, there's no base to contribute. So even the advice from World Health Organization in a 84-page booklet to medical professions is don't enter a debate on vaccines. But do speak to the public. Inform, advise the public, and don't try and argue with anti-vaccination people. It's something that you can't win against this group. The main message is focus on the public, not on the anti-vaccination people, and that's what I propose to do this morning. So is there a debate about vaccination? Unfortunately, the answer is yes. We're seeing vaccination figures go backwards. We're reducing vaccination rates. There is a modern trend, unfortunately, to be entirely dismissive of science and not to trust any government or international organisation or body. And that's made parents and others fearful about vaccinations. This lack of trust is present there. However, I believe in order to understand the situation, we have to explain what's going on. So I'm going to play devil's advocate a little bit and try and explain some of the arguments that are made against vaccination. in the hope that you will then start to understand a little bit more and become less worried, less concerned about vaccinations in general. If we look at the reality of the debate for 2019, this is from the USA. Already this year, it's only June, we have more cases of measles than in the previous 5 years combined. That's the effect of vaccination misinformation. That's the effect of not vaccinating. It's real. Because people say, well, it's only measles. I had measles as a kid. Didn't do me any harm. Well, it probably did. People have forgotten. Measles kills. In high-income countries, Europe and North America, the rate of death is about 1 in 500. In low-income countries like Africa, it's 1 in 100. That's the risk that you take by not vaccinating. We also have lots of ill-informed comments about this, including from the White House in the USA as well, saying, well, natural immunity is better, you should get measles and then recover and then you're immune. That's fine if you survive. How many of you wants to accept a risk of even 1 in 500 for their child? People won't happily talk about 1 in a million. We're talking about 1 in 500 deaths from measles. That's in high-income countries. And that's what's been forgotten. Vaccinations have been so successful, we have forgotten about childhood deaths, forgotten about just what the impact of these diseases were. So in this debate, it's exceedingly hard for the medical professionals even to start the debate, because their whole training has been on scientific method and evidence-based. And yet their opinion changes as the evidence is better, as different theories come forward and are proven and disproven. Against that, we have a whole weight of pseudoscience. My own grandson believes Facebook far more than anything I have to say. Okay? That's the reality of the modern world. And it's been exceedingly hard for the medical professions to accept that's the situation. They're entirely dismissive of this. This is nonsense. How can you possibly explain this? My proposal is that there are shortcomings on both sides. The medical establishment has not been able to communicate well, has not been able to talk about risks and benefits well. And the anti-vaccination lobby doesn't want to understand any science or statistical effects or a public health approach. All of this is then stirred up by a media that seeks to sensationalize every aspect of it. We get 2 measles cases, it's headline news all of a sudden. But equally, non-benefits, also headline news, screaming about autism, which I'll explain a little bit later. This stirs the pot and makes people confused, and then they become hesitant to vaccinate. This information is from Greece that looks at how most people view the situation. So at the top in the green, you can see information about diseases. Most parents believed that they know about diseases. They know about whooping cough and measles. They understand that. But in the middle, information about vaccines, every aspect of vaccines, they feel there's a lack of information. They just don't have the information about the vaccine. Then down at the bottom, the connection between vaccines and diseases, there's information, but they feel it's not communicated effectively. So we have different aspects. We're not getting the information, and then we're not communicating the information effectively. So the official stance is that public health messages have not always been a success. In fact, that's a euphemism for they've been a miserable failure. If it was a success, we wouldn't be seeing reducing vaccination rates. We're not getting the message across. We're not getting the message out there. We're seeing cases of whooping cough. Some of you are old enough, you may have had whooping cough before vaccination programs started. It's miserable for the child, and it's cruel for the parents to witness a child with whooping cough. Anyone who has seen it, I'm sure, would no longer be anti-vaccination. But we've forgotten all about it. It's almost been eradicated. But it's back, and it's back in a big way because of vaccine misinformation. Are there really fake news websites out there? I'm afraid, yes, there are. And there's a lot of them. This one here, Vaccine Tricks to Fool Muslims, is so bad, you could believe it's being produced by a right-wing group to discredit Muslims. It's just so appalling. But all down the list here are different ones which spread fake news. I have to be a little bit careful in including the Taliban on the bottom, since some of the conspiracy theories, those of you who are familiar with the hunt for bin Laden will know they were right, yes. People were trying to collect DNA samples from vaccinations, okay? But there's a lot of misinformation out there. And it's ubiquitous, all across Facebook, all across the internet and the web. It's so bad that World Health Organization and UNICEF have now put together a program to certify websites providing genuine vaccination information. And that's with this blue sticker, the vaccine safety net. So if you see that on a website, you know that the information you're getting is approved by WHO and UNICEF. That's how bad the fake news on the internet has become. This is the website from the Children's Hospital Philadelphia, east coast of the USA, and you can see it contains the vaccination sticker, so you know that's good, genuine information that you're receiving. If you see that, you can trust the website. There's so much misinformation around Muslim approach to vaccinations. I just wanted to make the point. This is a copy of a religious decree in favour of vaccination. This is from the Ulama, the Muslim Council. So the official position is in support, in favour, even to issuing a fatwa, a religious decree supporting vaccination in Pakistan and other countries. So there's misinformation both ways. There's misinformation about the misinformation. It's a mixed up world we live in. The next few slides, I'm going to try and play devil's advocate a little bit to try and explain this. I just want to make it clear, I am absolutely in support of vaccination. I am an advocate. I am completely convinced that this is the way to go. However, I also recognise that these days it's not enough to be right. We have to be able to explain why it's right, why it is correct. We have to be able to answer some of the arguments that are put against us. I'm going to give an example now of not listening. Some of you may remember the news items from 2007 about northern Nigeria stopping polio vaccinations. There was a boycott of the whole polio vaccination program in northern Nigeria. And some exceedingly strong statements were issued. We believe that modern-day Hitlers are deliberately adulterating the vaccines to make anti-fertility. Really harsh. The response of the medical establishment is, these guys are complete idiots. How can vaccinating a child possibly make the mother infertile? What is this? Contraception by telepathy? Yeah. They're lunatics, they're idiots. We're not listening. We're not paying attention. We're just allowing emotion on both sides to dominate. When that happens, the science goes out the window. Anyone who's worked in a vaccination clinic will know about 50% of your business is in fact providing injectable contraceptives. In those countries where women do not wish their partners to know that they are obtaining contraception. And that's not just the Muslim countries which we tend to focus on, it's also the Catholic countries, Philippines, most of South America. So typically the mother will use the excuse of taking the child to the vaccination clinic to obtain a vaccination, and while she's there she'll just happen to get a contraceptive vaccination. The most popular type is Depo-Provera, which acts for 3 months. It's a bit of a giveaway when you look at the medical records. Little Johnny is 5 years old and he's been to the vaccination clinic 22 times. It's a little bit obvious what's happening. So in this situation, who was right? The vaccines weren't causing anti-fertility. The vaccination program was being subverted to provide covert contraception. By not listening, the medical establishment then alienates itself, and there's a major public health concern because people are not getting vaccinated. We have to learn to listen more. In this particular case, the issue was solved by buying vaccinations from Indonesia. The vaccine came from there because it was certified as a halal vaccine. The people would accept it in northern Nigeria, and it went forward. But the key message is we have to learn to listen. Look behind what is happening. Don't just take the simple, straightforward, this is nonsense, it can't possibly be the case. So what's my message? Here with Bart Simpson to help us. We have to be hot, honest, open and two-way communication all the way through. And medical staff traditionally have not been good at doing that. And that's a new skill they have to start to learn. World Health Organization has acknowledged we weren't paying enough attention to public concerns. And that's allowed this anti-vaccination misinformation to proliferate, to go forward. However, there are really difficult problems on communicating vaccination information. The first one is it's exceedingly difficult to prove a negative absence. Sounds a bit strange, doesn't it? How do you prove there are no little green men from Mars? Well, I've never seen them. But they're invisible. How do you prove there aren't any? It's very difficult to prove a negative absence. The next one is fake news travels very fast. If we look at the report from New Scientist magazine, their survey showed that fake news travelled 6 times faster than scientific information. The other point is we've not been good at explaining. Not all vaccinations are 100% effective. They don't guarantee to give you immunity. We've got to explain about risks and probabilities and potential benefits. Another area, particularly in this region, we have to think about is the presence of fake vaccines. And yes, I'm afraid they are there and around. And I'll be talking a little bit more about them shortly. So negative absence, I'm going to give you an absurd example, which is that excessive hair grooming causes cystitis. You probably know cystitis is a bladder problem which causes a frequent need to urinate. You've got to visit the toilet very often, okay? And it's a burning, unpleasant feeling. Cystitis has got many potential causes. Lots of things can cause cystitis, so it's often not clear for a particular patient what's caused cystitis. But people who go to the bathroom often, while they're there, they will often adjust their hair, adjust their makeup, and look smart. So there is this myth that if you comb your hair too much, if you have well-groomed hair, you'll get cystitis. Well, that's obvious nonsense, isn't it? But how do you prove it's not true? How are you going to prove it's not true? And that's the problem we've got in a negative absence. We'd have to enroll a whole group of bald people who don't need to comb their hair and do a massive study, and at the end of the study we wouldn't prove anything because there are so many different causes of cystitis. Well, that's clearly nonsense, isn't it? It's just a myth that's grown up. But we have this argument that if you can't prove it's not true, then it's true. Yeah? It's almost an adolescent 13-year-old argument, but that is often used against us all the time. Now we get more serious. We move from absurd to autism. How do we prove that vaccines do not cause autism? They don't. But how do we prove it? It's exceedingly difficult. We have masses and masses of study. Over 1 million children have been studied for 10 years. And there is no connection. But how do you prove it doesn't? What you can say is, we can't find anything. So we have to fall back on, if we can't find it, it's not there. And that's never very satisfying. And that's one of the difficulties we have around vaccination misinformation. They will use this approach to say, you can't prove there isn't a connection. And nobody can. That's often a difficult area. I'm going to talk more about autism very shortly. Okay, so here we have the major myths on vaccines. We've got autism. Andy, he knows absolutely that vaccines cause autism because there was a paper published over 15 years ago that said there was. The fact that it's been totally disproved and debunked doesn't matter. He knows it causes autism. We've got poisonous Pete. He said it's not the vaccines that are causing the problems, it is the preservatives in the vaccines. They're toxic, they're poisonous. They used to contain mercury. Well, mercury is poisonous. Well, I think most of you probably drink a little alcohol occasionally. Alcohol is poisonous too. But no one is likely to stop. Dosage is very important. Whether you're having 5 bottles of scotch a night or a couple of beers makes a big difference. So it is with these, and I'll explain more about it soon. Then we've got Loony Lucy, who is convinced that the Illuminati are in control and they're running the World Vaccination Program. Well, I can tell you at the World Health Organization in Geneva, most days they can't even find the light switch. We could use some Illuminati around the place to brighten it up. Okay. Then we've got Hoaxy Holly. Vaccinations are a con trick by the pharmaceutical manufacturers to make money. It's all about income generation. The fact that most vaccination companies are going out of business because they can't make a profit is by the by. Then we've got hygienic Helen. Yeah, vaccines work, but you don't need them. With modern hygiene, nobody gets infected. All you need is soap and water and you're okay. And then finally we've got naturalist Nancy. Yeah, vaccines don't provide the same immunity as catching the disease. So you should catch the disease and then you've got natural immunity. That's better. And I'm going to try and go through these 6 areas now and debunk some of them. However, using my hot, honest, open and two-way communication, I'm going to try and explain some areas, and that means we have to admit there have been conspiracies. Hoaxy Holly, the hunt for Bin Laden, invented and subverted an entire vaccination program to try and collect DNA samples. So there have been some conspiracies. There have been attempts by Big Pharma to influence the World Health Organization. I'm going to explain those shortly. Most vaccines do not provide 100% protection. So they're possible to be vaccinated and still catch the disease. It's rare, but it is possible. And I'll explain those as well. And there are side effects and rare adverse effects to vaccinations. So we have to be open and honest about this as we go through. I believe that by being open and honest, we strengthen the case of vaccination. Okay. So here we go, debunking the myths. Vaccines don't work. Well, there is just so much evidence that vaccines work that you really can't make that argument. That the sheer weight and volume of scientific evidence is there. However, we have to say, not all vaccines are 100%. And I'll explain that shortly. We also have to acknowledge that there are fake and OS, which means out of specification vaccines, substandard vaccines around. And if you're getting a fake vaccine, of course it doesn't work. I could put up another 20 graphs like this, which show as we increase the vaccination rate, the rate of the disease goes down. Vaccinations really have been massively effective all around the world. And I'm just going to go through these quite quickly. This is diphtheria, and again we see the massive drop. As we get the vaccination rate up, the disease level drops down hugely. And we have hundreds of these graphs and data collected from all around the world to show vaccines really do work. Next one is for polio vaccine, really crashing down on this one. Vaccination rate on the line, the columns show the number of cases. lots and lots of data, lots of hard evidence to show vaccinations work. On the world stage, there are now only 2 countries where polio is endemic. That's Afghanistan and northern Pakistan. It's exceedingly hard to run vaccination programs when people are shooting at you. Nearly every month, unfortunately, some very brave vaccination workers get killed there. It's a major conflict zone. We see in DRC, Democratic Republic of Congo, Ebola is getting out of control because we can't do a vaccination program because it's a conflict zone. They're attacking field clinics and hospitals. But overall, the message on the world is massive reduction in disease burden from vaccinations. And it's estimated that each year vaccines save about 23 million lives. And the newer vaccines are just starting to come along now to reduce further disease burdens. Okay, so the anti-vaccination lobby, Hoaxy Holly there, claims it's sanitation. And it's true. Improved sanitation has led to less disease and less death from disease. However, that's not been the main driving force. If we look at figures from the USA, because we have good quality data, measles vaccine was introduced in '63. 10 years before '63, there were about 400,000 measles cases per year. By 1970, that had dropped down to 25,000. How much did sanitation improve in the States between '63 and '70? Okay. That's not responsible for the reduction. Yet sanitation has helped. It really has contributed. But that's not the driving force. More recent data for HIV disease between 1990 and 1993. How much did sanitation improve in 3 years? And yet HIV went from 20,000 a year down to 1,500. So, massive effect from vaccination. Other factors certainly contribute. They're there, but they're not the dominant force. And that's part of the vaccination information. They'll take a grain of truth and then seek to blow it and exaggerate it beyond all reason. Certainly sanitation has helped, that's true. But it's not the driving force that's made the reduction in disease burden. This is data from Australia on the recently introduced rotavirus vaccine. And again, how much did sanitation improve in Australia between 2007 and 2008, when the vaccine for rotavirus for childhood gastroenteritis was introduced? Massive reduction. That's the impact of the vaccines. Another common ploy from the anti-vaccination lobby is to take mortality rather than morbidity. They take the number of deaths. Okay? Less people are dying because of better health care. That's absolutely true. If we look at the deaths from measles, in high-income countries, North America, Western Europe, Australia, New Zealand, the death rate from measles is about 1 in 500. In low-income countries like Africa, it's 1 in 100. It's less in North America, Europe, because of better healthcare. So certainly, better healthcare has helped reduce number of deaths. But if you have the vaccine, you don't get measles in the first place. Nobody has to die of it. We're missing the whole point by focusing only on the deaths. It's true, deaths have been reducing for many years because of better healthcare. But don't get the disease and you don't die of it. Perhaps the biggest argument we've got for do vaccines work is, what happens when you stop vaccinating? Well, unfortunately, as you'll have heard from all the news reports from North America, especially Europe, it's obvious. The disease starts making a comeback. And we don't have to drop down very much on the rates of vaccines. Once we're below 95% of children vaccinated, the disease can spread. And I'm going to talk a little bit more about that under herd immunity shortly. We're seeing all these rises because we're not vaccinating. And that's our biggest argument for vaccination. Look what happens when you stop. Is it not clear and obvious to everybody? Well, hang about a minute, hang on. If vaccines are so effective, how is it there's still disease in the world? Why haven't you eradicated all the diseases? Because you're telling us that vaccines are so good. Well, unfortunately, the global vaccine program has not reached its targets, not by a long way. And we talk about the vaccination gap. And if we look at the vaccination gap, we find there are 65 countries where we don't meet the target for the most basic, simple, 40-year-old childhood vaccination against diphtheria, tetanus and pertussis. Pertussis is whooping cough. For measles, 15%. We haven't reached the world targets. For rubella, used to be called German measles, not even 50% of the countries in the world. Neonatal tetanus, 21. Polio, a bit more of a success story, just 2 countries now that are still subject to that. We have a massive gap. Fortunately, Bill and Melinda Gates Foundation in 2016 just made major grants. So we are hopeful now that we're going to start closing the vaccination gap. Vaccines work. They only work if they reach people. And we still have to reach a lot of people. Individual effectiveness of vaccines. Not all vaccines are 100%. We take the most common childhood vaccine, MMR, measles, mumps and rubella. It's only about 99% effective for measles. What does that mean? 1 in 100 people who are vaccinated will not develop immunity. So you've been vaccinated and you might still get measles. About 1 in 100. For mumps we're not so good. It's about 12 in 100. But you can still be protected, even if you don't develop immunity, if everyone around you has been vaccinated. Because then they can't transmit the disease. If nobody gets the disease, nobody transmits the disease. So that point of transmission is there, and we have to be open about this. It's not 100% on vaccines. But if we have a better than 95% vaccination rate, you can still be protected. Long-term protection, not all vaccines provide long-term protection. They're not always for life, but that's a feature of the disease. If you have pertussis, whooping cough as a child, you can contract it again in your 60s. The immunity does not stay with you for life. That's nothing to do with conspiracies of the pharmaceutical companies trying to sell more vaccine. It's a feature of the disease. So, you may need to be vaccinated against whooping cough in your 60s if you feel at risk. And there are guidelines for that. Not every disease is immunity for life. And the same with vaccines. They follow the disease patterns. They don't give immunity for life. Immunity to measles is for life. Vaccination for measles is for life. Whooping cough, pertussis, that's not the case. Diseases change over time. You all know about the flu vaccination and how often influenza changes every year. It's a race to try and keep up with it. Other diseases change too. And that means changing the vaccines for those diseases and changing the mix, trying to keep pace with disease development. Okay, I talked about herd immunity. What is this herd immunity? Basically, it means if everyone around you in the yellow there is immune, they can't transmit the disease. And once that level is above about 95%, disease transmission can't occur. So even if there's one person in 100 who is not immune to measles from the vaccine, everyone around them is protecting them. So I want to bring forward this idea of a public health concept, and that is that not only is the vaccination a protection for you, it's a protection for the community. You're preventing the disease spreading, as well as protecting yourself. And that's a major point that's often lost. You are a shield against the disease being transmitted. In order for that to happen, we need vaccination levels above 95%. Yeah, I'll just skip all of that one. Can we? Oh, sorry, it did click. That's me. I went forward too much. Okay. Well, what about these stories of vaccines that don't work? Well, it's true. There are fake vaccines. Republic of Niger in northwest Africa, 2015, around 600 people died. The presence of fake vaccines were detected. Are people deliberately faking vaccines? Yes, I'm afraid they are. And Niger is particularly badly hit because in 2017, the fakers hit again.
Oh my God. That's all.
In 2015, the fakers collected empty vaccine bottles and refilled them with water and just changed the expiry dates by hand. In 2017, they got their packaging a bit more upmarket. This was detected almost immediately because this particular company doesn't make vaccines. Okay. Indonesia had been retailing fake vaccines for 10 years before they were caught. How many deaths, how much damage is going on from this? So fake vaccines, I'm afraid, are a reality. Well, just a minute, what are you guys down at World Health doing about this? You are supposed to be in charge of all the medicines for the world, aren't you? You're sleeping on the job. Well, I used to work at Neglected Tropical Diseases, which is a wooden hut out the back of the UN building in Geneva. And next to us was the Global Surveillance Program. We were in a cardboard box. So until 2012, there was no global surveillance program. It didn't exist. It was up to individual countries to report fake medicines, and then that news was circulated by the World Health Organization. In 2012, the US government provided a major grant to start a global surveillance program. So we now do have a global surveillance program on substandard medicines. Unfortunately, we now come to our conspiracy theory. Prior to 2017, the definitions we had to use for substandard medicines were substandard, spurious, falsely labelled, falsified, counterfeit medical products. SSFFC. Big Pharma, the big manufacturers, insisted that World Health observe intellectual property rights, observe patent law. Now, some people argue this is a conspiracy. Well, the definition of a conspiracy is to do something illegal. What they were asking for was to do something entirely legal, which was to observe international patent law. It was also not secret. All of this is published in very long-winded reports every year of the meeting of the Global Monitoring Program. Fortunately, in 2017, intellectual property rights were taken out. We have a new definition now called OOS, out of specification, OOS. So either the vaccine meets the standard or it doesn't meet the standard. Whether it's in breach of patent law or not in breach of patent law is no longer our concern. That is the concern for the manufacturers and the civil courts. All we're looking at is the quality. Does it meet the quality? Yes, no. So since the program started in 2012, we're seeing an increasing number of fakes. Part of that is because we've got more monitoring centres. So as you look more, of course, you find more. And that probably won't level out for about another 5 years until we've got a complete global network of monitoring centres around the world. So how bad is this fake vaccine? Well, the majority are in Africa. For us in Southeast Asia, we've got relatively few, just about 2% of the of fakes on the world coming our age. That doesn't mean they don't exist. We've had fake yellow fever vaccine in Bangladesh, and I'll talk about some more examples of fakes very shortly. Among all the medicines that are fake and counterfeit, vaccines is the lowest at only about 2%. However, that 2% still equates to 29 cases in 11 different countries. That's fake vaccines out there. For 2019, so far this year, we have 3 reports of fake vaccines: rabies in the Philippines, cholera in Bangladesh, and once again Niger, fake meningitis vaccine. They're back again. They seem to love faking vaccines in Niger. So it's a real threat. Number 2, vaccines cause autism. This is a case of bad science and fake news. Unfortunately, in 1997, a British surgeon published a paper in The Lancet. The Lancet, until that time, was a high-prestige medical journal. Since that time, you can't give it away. In fact, I received a free subscription to The Lancet. This paper was totally debunked. Firstly, they couldn't reproduce any of the findings. The ethical considerations were an utter disgrace. This man was trying to patent his own vaccines at the time. He invited children to his son's birthday party and took blood samples from them. It just went on and on and on. It has been completely debunked all around the world. Absolutely not there at all. But it lives on. It lives on as fake news. Everyone will still quote this paper as being there. It should never have been published. All the medical journals have had to revise totally the way that they now review articles prior to publication. It's much stricter. It's very hard to get an article published now at all without a massive peer review and checking of the results. But it has been completely debunked, and I can't stress this highly enough. Completely debunked. Further, there's been long-term massive studies. The Danish study 500,000 children together. Could not find any link between the vaccination and autism. It is tragic for the parents. The parents are trying to find a reason, trying to find how this happened. So it's naturally to grasp at circumstantial evidence. Until quite recently, autism was detected about the same time or shortly after the time when childhood vaccinations were given. More recent research is now finding autism well before vaccinations are given, shortly after birth. The exact cause of autism is not known. However, the latest theory, and it's only a theory, is that it takes 2 conditions to come together concurrently. There has to be a genetic component. That alone is not enough to cause autism. People who have that genetic component never develop autism. There has to be a trigger, an environmental trigger during pregnancy. And it takes the 2 together to cause autism. So autism occurs during pregnancy. It is not related to vaccinations. However, I've got to prove a negative absence. I've got to prove that vaccines don't cause autism. And that is so difficult to do. People said, well, it's not the vaccine, it's the mercury in the vaccine. In childhood vaccines, they used to put mercury as a preservative. In fact, that was almost never used in North America and Western Europe. It was only used in large multi-dose vials that we use for refugee camps in Africa, when we do mass vaccination programs. The majority of people in North America, Western Europe, never had mercury in the vaccine. In response to all the clamour, CDC removed it. We're not happy about that because there was no evidence it was linked whatsoever. However, we can be sure that that is not the case now because there's no mercury in the vaccine now. And we're still seeing cases of autism. This mercury is called thimerosal. Just a little bit of toxicology. Most of you will know the difference between wood alcohol, methyl alcohol, MEFs, and ethyl alcohol, which 1 or 2 of you might consume occasionally. You know that wood alcohol is far more poisonous than ethyl alcohol. Well, the mercury that you get in tuna fish is methyl mercury. It's about 1,000 times more toxic than ethyl mercury. If you've had dental fillings, dental amalgams, you've got more mercury in your teeth than you will ever receive in a whole lifetime of vaccinations. If you eat sushi, you're ingesting far more mercury than you're ever going to get in all the vaccinations, and you're ingesting the methyl mercury, the more toxic form. I'll talk a little bit more about preservatives later, but let's understand dosage levels. These are minute compared to what you're eating. Over 10 different studies now, 1.2 million children. We can't find any link between vaccines and autism at all. None. 1.2 million children for 10 years. Followed up, we can't find any link. And still we have this fake news of vaccines cause autism. Okay, myth number 3. The vaccines are okay, but you're giving the kids too many. It's too many at one time. Most childhood vaccination programs offer around 14 vaccines over around 18 months, 2 years. Thank you. Very kind. I'll have a little vaccine. In fact, if we make the calculations on a theoretical basis, the child could have 10,000 vaccines. They're exposed to far more infection on a daily basis, particularly if you live in Pattaya, with the air in this town, than anywhere you're likely to get from the vaccines. It's just not the case. Natural immunity is better than vaccine-acquired immunity. Well, in some cases, it's true. The vaccine for Ebola is not very effective. So if you get Ebola and survive, you will have much stronger natural immunity. The only problem is the death rate from Ebola is about 90%. Let's get real here. The whole point of having the vaccine is you don't get the disease. Yeah? Yes, it is true. Natural immunity can, in some cases, be better than vaccine-acquired immunity. But the advantage is you don't get the disease in the first place. And that's a major point forward. This idea is, I don't need the measles vaccine because I'll have natural immunity. Only works if you survive the disease. Vaccines contain unsafe toxins. I mentioned mercury. They also sometimes contain formaldehyde. Oh wow, formaldehyde. It's what they use to embalm people. That's really poisonous, yeah? I asked you before if you eat pears. There's more formaldehyde that occurs naturally in pears than you'll ever get in all the vaccines in your life. It's a natural product of pears. Okay? So when we're looking at these toxins, we have to have a little bit of toxicology knowledge, little bit of understanding of what's going on. Not just, that's poisonous, and that's it. Okay? Some of you in this room may be taking sodium warfarin as a blood thinner. Okay? Well, sodium warfarin, that's rat poison. We're giving you rat poison. Well, generally speaking, most of you are quite a lot larger than a rat. So the dose that would kill a rat is not going to kill you. So the effects of these toxins have to be taken. They're present in minute quantities as preservatives. Okay, very common one. I don't need to vaccinate because infection rates are now so low. Don't need to bother. No one's had measles for years. Don't need to worry about it. No? Well, the problem with that is I need to get this 95%. The other problem is non-vaccinators tend to cluster together in geographical areas. It tends to be a religious or a social cultural group. What happens when I fall below 95%? Well, the UK found out last year. They went down to 92%, and we saw cases in Ireland and in Wales of measles outbreaks. As soon as we get below 95%, it's there. If we look here in Serbia, 86%, and they got hundreds of cases. because we don't have this herd immunity to prevent the spread. Typically, one measles case will infect 11 to 18 other people. It's an exceedingly contagious disease. If you sneeze in this room with measles, even 4 hours later, you could contract measles from the air droplets in the room. It's that infectious. So this herd immunity, this data is from Holland. Holland reaches the 95% level for vaccination, but that's the national average. Unfortunately, the non-vaccinators are clustered together. So in the red is where the measles cases occur, in the blue is where there are low vaccination levels. So even though it's 95% nationally, there are pockets of vaccine deniers, and that spreads the disease. Because in those areas, you're well below the 95%. So it depends where you live, and that's what happened in Wales in the UK. South Wales, there was a whole cultural group who decided we're not going to get vaccinated, and then there was a major outbreak of measles. Vaccines have serious side effects. Well, vaccines do have side effects. Most are transient, most are minor. There are, it is estimated, serious side effects about 1 in a million cases. So we just think about this. The rate of death from measles, if you're in a high-income country, about 1 in 500. The possible serious adverse reaction doesn't mean death from the vaccine. 1 in a million. What's the ratio of probabilities here? How do we explain this to a worried parent? How do we get this message across? Information on the vaccines. I talked earlier about lack of information. There is a complete information sheet for every vaccine published online by the Center for Disease Control in America, and there are separate sheets for all the adverse reactions to every vaccine published online, which if you have trouble sleeping, you can look through and find all the detailed information there. But generally, the rate of serious adverse reaction is so low from vaccination, we can't even measure it accurately. 1 in a million is an estimate. Vaccination is one of the most cost-effective interventions it's possible to have among all the health interventions. This really does bring value for money because it protects that child for life against the disease. And it brings massive health benefits. It's generally reckoned the ratio is about 1 in 16. If you have the full range of the 14 WHO childhood vaccines, it's generally reckoned to cost about $1, $1.50. It will save $16 in health interventions for every dollar you spend. Massively cost effective. Okay, so in summary, vaccines work. There's no evidence they cause autism. They have an excellent cost and risk-benefit ratio. Relying on herd immunity is not safe. You do need to get vaccinated. We need universal vaccine coverage, and that means better than 95% for them to be effective. Not every vaccine is suitable for every person. Take individual medical advice. I am not making blanket recommendations here. Make informed decisions. Don't be misled by vaccine misinformation. And try to adopt a public health perspective. Okay? We have the situation where some parents are demanding no peanuts in the school because their child has a peanut allergy. But equally, will not have their child vaccinated. So they want public health to go a long way. Okay, I've talked for quite a long time. I'll stop now for questions and any discussion.
Any questions?
I would just like to jump up and really thank Dr. Andy Barraclough for yet another international quality talk. You were amazing, the talks you give. And also because we had a whole, it was my idea about 9 months ago for you to give this talk, and he was supposed to, I booked him and he said, oh, I'm much ready, can I do earlier? And we tried 4 dates earlier and you're always busy because he has a lot of demands on his time. And then he very graciously, he was due to give a talk the date that Dr. Minot could give a talk, and he graciously gave that up, and people remember how wonderful Dr. Minot's talk was, and that was because Andy was gracious enough to cede that talk to Dr. Minot. So thank you. Thank you, Andy.
Thank you, Andy. Excellent presentation. I too am pro-vaccinations, but just adopting, I think it was naturalist Nancy was the character on your slide. Do you think the success of some vaccinations, which curtail the natural immune system, actually then leads to other diseases taking effect?
No, completely wrong understanding there. Vaccinations don't reduce the immune system. It's the exact opposite. They promote the immune system. We want to engage the immune system to make the antibodies to the disease. That's what we do by giving the vaccination. So you increase the immune system with vaccinations, not reduce it.
Andy,
Yep.
I'm just wondering if you can tell me why Andrew Wakefield is not in jail, or at least if a class action has not been taken against him for the damage he's caused.
There are many lawsuits against him. None of them have come to conclusion. I think it would be very hard to find him physically at present. Many people are looking for him.
Good to hear. Thank you.
But it was an utter disgrace. And even worse, because some of his research did produce a link between stomach chemistry and brain chemistry. And that might have led on to some interesting conditions. And all of that's been abandoned because of this discrediting the whole lot. But it was such bad science, and then such conflicts of interest, it would be hard to deliberately design something that was that bad. Really, it was not a disgrace. And the Lancet deserved all the criticism they got for publishing it without checking it. They rushed to publish it because it was such a headline news.
But I just remind you, just one question. If there's time later on, you can have another question.
Thanks, Doctor. It's a great talk. If both parents of a child have had all their shots, do any of the value of the immunity that they received from the shots pass on to the child?
Basically, no. The immunity can be passed to the child, but generally speaking is not. It takes multiple generations to build up to pass that. The kind of immunity that's passed on to the child is the immunity present in DNA configurations. Certain configurations produce a greater resistance. We shouldn't call it immunity, a greater resistance to the disease. That can be passed on. But immunity, generally no.
Thank you, Professor. You've got a shot on the screen there that says vaccination situation in Thailand. Even before seeing that, I was going to ask, do we know how widespread lack of knowledge of vaccine is in Thailand? I've got two personal examples. I have a lovely 6-year-old Thai granddaughter whose mother, and she is a single mother, has never given her child any vaccinations whatsoever. And when we've spoken to her about it, she says we are interfering with the upbringing of our granddaughter. And the other one is that my wife and I, Thai wife and I, are guardians of a 5-year-old Thai girl whose mother, when she was about 3 years old, her mother disappeared. And we were left to look after her. We know that she has never been vaccinated, and even though we have tried to have this done, the hospitals and the health people in Thailand say we can't because we haven't got the mother's permission, but the mother's not around. So how widespread is this situation in Thailand?
Okay, I have another presentation which will take 5 or 6 minutes if you want to have it on vaccinations in Thailand. You want to have it?
We live here, yeah.
Yeah, is there a vote to go another 5 minutes? Okay. All right. Let's go on. Okay, so the situation in Thailand. Thailand follows the WHO childhood vaccination program, 14 vaccines, with the addition in Thailand of Japanese encephalitis. All of this information is available online. I'll just say a word, it's not just humans that need vaccination, don't forget your pets as well. Well, that's good, that's the situation. If we go on now, just for a quick look. Well, the vaccination rates in Thailand, look, 99%. I don't need to worry about vaccinating because there's herd immunity. Everybody's been vaccinated, so everybody around me is immune. I don't need to worry too much about it. Yeah? Well, it's not quite that simple. If everyone's immune, how is it we're still getting cases of measles and mumps every year? Everyone's immune. I've got 99% vaccination rates. How is it I've got these cases coming along every year? Because of geographic clusters. People that were not vaccinated, this is for measles. These are blood samples from new recruits to the armed forces, so they're generally 17, 18-year-old males, and we just happen to borrow some of their blood to do a test. We see on the border in the south, and just south of Bangkok, another community where there are very low vaccination rates, because the non-vaccinators are in geographical clusters. And that's where the danger lies. And is there vaccine denial in Thailand? Well, I'm afraid so, because last year 18 people died of measles in Thailand. Is it real? Yes. You need to get your kids vaccinated? Absolutely yes. Because 1 in 100 will not develop an immune response. Yeah? So I need to have massive coverage of all of that. And over 2,000 cases in the south of Thailand, we've got vaccine denials among largely the Muslim communities, even though we've got official Muslim bodies to issue the fatwa, the decrees. It's not against the religion. We've got individual cultural speakers advocating against vaccines. That's here in Thailand. The vaccination regimen for Thailand for adults depends where you're going to go. Vaccination information, if you're going to be stomping around the rural areas in Thailand, visiting the sick buffalo, volunteering to work on the elephant farm, something like that, you really should be thinking about Japanese encephalitis. Yeah? Tetanus, every 10 years. If you happen to frequent some of the hostelries of the town, perhaps you're walking alongside a cow after taking a few malt beverages, and you cut your toe on the road. Tetanus can be real, a real threat. It's only once every 10 years. So it's worthwhile keeping that up to date because it's a high risk. Other ones depends very much on your lifestyle. Do you need rabies vaccination? There is pre-exposure vaccination to rabies. It's expensive, it's about 10,000 baht. But if you're working in rural areas with dogs, it might be worth considering. Hepatitis B, again, if you're handling tools and sharing equipment with blood transfer, worth considering. Particular cautions around Japanese encephalitis. You may remember about a year ago, the wild boar football team in the cave rescue, they were held in hospital for about 10 days before they were released. They weren't held there to check for their infection. They were held there to prevent them infecting their families when they went back home. There's a particular problem around caves in Thailand. Many infections possible. Okay. Yellow fever. Well, I've talked about fake vaccines. Now I have to talk about fake vaccination certificates. They are circulating. don't be tempted to buy one, you will be caught. The port authorities in Thailand have the UV light to compare and check whether it's a genuine vaccination certificate. You don't need yellow fever for Thailand, but if you're going to enter Thailand from a yellow fever area, you will need to show a vaccination certificate at the Port Health Authority. Unfortunately, Bangkok immigration is not well versed in the WHO list of yellow fever countries, so they tend to take anywhere from Africa and anywhere from South America. You need to have a yellow fever certificate. Okay. Do be careful about the fake vaccination certificates, get a real one. There's a whole pile of different vaccinations for adults, shingles being one of them. It's a separate presentation of about an hour on what might be appropriate for you. So I won't talk too much about those, other than that there's lots of areas to think about. Which ones are appropriate for you depends on your lifestyle. Childhood diseases infect adults. There was a massive outbreak of rubella in Japan among 50-year-olds because they never got vaccinated. Japan stopped the vaccination program. Don't think that you're immune because you're old. Keep the vaccinations up to date. Okay, that was the quick run through on that, but the message is yes. How do you get your child vaccinated? That's difficult without the parents' permission. It really is difficult in Thailand. The legal medical case is that you can't do it. And you may have to resort to other ways.
At the back here, please.
Yep.
Just before I start, I should declare that I do have a financial interest in vaccinations. I have shares in CSL, which have been by far my most successful shares, and they deal in blood products and produce vaccinations. And I hope you're wrong about those vaccine companies going broke, because if CSL goes broke, my sex appeal will go right through the floor.
Okay, it was for basic childhood vaccines. It was a misunderstanding by UNICEF. So UNICEF buy 5% by value of the world market. Well, that's nothing, is it? Unfortunately, that 5% by value is 45% by volume. So UNICEF buys nearly half the world's supply of childhood vaccines.
It may have stayed that way.
And they screwed the price down, so a number of companies just said, not worth making it. And now we're scrambling to recover from that situation.
Yeah, just an observation on, I think it was you said 1 in 500 people with measles pass away. Yeah. Well, as someone once said, there's lies, damn lies and statistics, and I think statistics always need to be tested. And I would assume that 1 in 500, if you looked at that one death, certainly they'd have had measles, but they'd have had other problems as well. They would have had, maybe they're drinking dirty water, or they have other medical problems, and they die with measles, and measles might be just one of the reasons why they die.
That's certainly the case. I mean, it tends to be people who are already with weak immune systems and already subject to other diseases, yes?
Okay, on your right on there.
Thank you. I'm rather worried about a granddaughter who's 9 who has had no immunisation at all. She lives in Australia, and her mother is rather stringent, and she's not having any shots. But in Australia, when you go to public school, and I get this from my daughter-in-law who's a deputy principal, that you, in actual fact, at a government school, you have to have a letter from your doctor or proof that you've had all your immunisation. But my granddaughter goes to a private school, and that's not the case. So you would think if the government brought it in to the private school, that would soon benefit all of Australia. Thank you.
Okay, I follow the official World Health Organization position on this, which is that we do not advocate compulsory vaccination. And the reason for that is it doesn't work. It's not that we're politically against it. The evidence is when you try to implement it, it drives it underground even more. you get fake certificates, fake letters, and then the case is not known. So we don't advocate compulsory vaccination. We say it's better to have it out in the open and try and deal with it than drive it on the ground.
I'm going to just jump in here, Andy, because I want to do this with you. In 2 weeks' time, on the 7th, we've got something special is happening in the sense that we have people doing a dengue fever study through the expat community and Zika study through the expat communities in Thailand, right? So they're going to be coming in and they're going to be talking a bit about dengue fever and answering questions about it. It is an election day, so it'll be a shorter talk. But we'll also be doing health checks with people, taking health records and taking blood samples. So this is a very, very unique opportunity to not just inform yourself better about dengue fever, but actually expats helping expats by helping see what sort of penetration and stuff dengue fever has in expat communities here. And I'm hoping we will get some sort of feedback about what proportion of people have been exposed to dengue fever. Because who here actually heard Dr. Andy talk about dengue fever a couple of years ago? One of the great talks we've ever had, as this talk was great as well. So we'll send a link and you really want to listen to that talk. But in 2 weeks' time, something special on dengue fever, a special morning for the club. And you know these people in the state they're doing.
So they're from Mahadum University Travel Clinic. Yeah.
And they're really top people, yeah.
On your right, Andy.
Yep.
I just want to say I'm totally in favour of vaccination, but I discovered I have a problem. I wanted to have the flu vaccination many years ago when we first started getting it here at the club, and I happened to mention to Gavin that I have an intolerance of egg white, and he said, you cannot have flu vaccination because of that. I just wondered if the manufacturers realise that we should know what goes into the vaccine so we can make that decision. You wouldn't normally tell everyone that you've got food intolerances just because you want a vaccine. No, they never.
Right. The majority of flu vaccines are grown in eggs. So they do contain egg proteins and egg peptides in the vaccine. There are vaccines which are not grown in eggs. So there is a vaccine available, but it is rare, it is hard to get outside the USA.
I have a question about vaccinations in Thailand, and you might not be able to answer it, or the thing is, you show very high vaccination rates in Thailand. And then you show some clusters. And the clusters are very large. Is there some chance that the vaccination rates aren't as high as we think they are?
Generally speaking, the records in Thailand are quite good on vaccinations. And they report quite well. And most provinces have a unit whose specific job is to follow up. So if your child doesn't get vaccinated, someone's going to come knocking at the door to follow up on that. So they probably are very high. The clusters are high because they are geographically by province. In fact, it's probably only a small area within the province, but because it's mapped by province, it looks big.
On your right, Andy. Sorry, hand over to Albert.
Yes. Professor Andy, in the interest of open discussion, vaccination is not immunization.
That's correct, yes.
That's, I spell immunization with a Z.
Well, we're ambidextrous on that one.
Right. And my website, vaccinationisnotimmunization.com, rebuts many of your slides.
Fair enough. We will differ on that one. Yeah.
And there's no ad hominem on my website.
Okay. And there's no?
No ad hominem on my website.
Okay.
Are there any more questions?
you have any on dengue? Well, yes, I do.
Okay, please thank once again Dr. Andy Baraclough. And we're going to add another well-earned certificate of appreciation, Andy. Thank you. The iPhone's coming. Thank you once again. Thank you. Pleasure.